Hello viewers, you're welcome. In today's video we're going to learn about the musculoskeletal system. The human skeleton of an adult has 206 bones, while for infants they have slightly more than that because some of their bones fuse later in life, especially the hip bones and the vertebral column. All these 206 bones are divided into two principal divisions, that we have the axial skeleton and the appendicular skeleton. Let's begin with the axial skeleton. This consists of bones that lie along the longitudinal axis of the human body. This actually refers to an imaginary line that runs through the center of gravity of the body, that is from the head to the space between the center of gravity of the body. This axial skeleton actually consists of 80 bones. These bones are the bones of the skull, the auditory ossicles, the hyoid bone, the ribs, sternum, and bones of the vertebral column. And this now brings us to the appendicular skeleton, and this consists of 126 bones. The bones are of the upper and lower extremities, and the bones that form the girdles, the pelvic and the shoulder or pectoral girdles. Let's start back at the axial skeleton. We're going to be getting the numbers of the bones, how they come up to 80. This 80, how we come up with the 80, we start with the bones of the skull. We have the cranium. The cranium has 8 bones. The face has 14 bones. There is 1 hyoid bone. The auditory ossicles, there are 6 bones, 3 on each side. The vertebral column consists of 26 bones. The sternum has 1 bone, and the ribs are 24. If you add all this, you come up with 80 bones in total. Let's also look at the bones of the appendicular skeleton, where we have the pelvic girdle. This has the pelvic coxal bone, their twin number. We have the lower limbs, comprised of the femur, which are also twin number. Patella, there are 2. Fibular bones are 2. Tibia, there are 2. Tarsals are 14, 7 on each side. Metatarsals are 10, 5 on each side. And phalanges are 28, 14 on each side. And then at the pectoral girdle, we have the clavicle and the scapula that happen to be 2, 2 on each side. Let's proceed to the bones of the upper limbs, where we have the humerus, there are 2. Radius, there are 2. Ulna, we have 2. Carpals, we have 16, because there are 8 on each side. Metacarpals are 10, 5 on each side, and phalanges are 28, 14 each side. This all together makes a total of 126 bones of the appendicular skeleton. And let's briefly look at the types of bones by shape. When we look at bone types by shape, we have these classifications: flat bones, then we have regular bones and sesamoid bones. Briefly, let's only look at these ones. Examples of flat bones: we have the cranial bones, of the sternum, we have ribs and scapula. Under irregular bones, we have the vertebral bones, have the hip bones, we have facial bones and calcaneus. Sesamoid bones, we have the patella. They are flat, shaped like a sesame seed. Now let's look at cranial bones. Under cranial bones, we have the frontal bone. This forms the forehead. We have the parietal bones, they are twin number, form the roof of the cranium. Temporal bones, they also twin number, form the inferior lateral cranium. Spittle bone, this is actually 1 and forms the back of the head. The sphenoid bone, this forms the middle part of the base of the skull. The last cranial bone you have is ethmoid bone. It is in the midline in the anterior base of the skull. So all these 8 form the cranial bones. From the cranium, let's go to the facial bones. These bones are 14 in number. Let's look at how we've come up with the 14. We have the nasal bones. They are 2 in number. They form the bridge of the nose. Then we have the maxilla. There are 2. They form the upper jaw. We have the zygomatic bones. Here they are also 2. These are the cheekbones. They form the prominence of the cheeks. We have the lacrimal bones. They are also 2 in number. They resemble fingernail. They're the smallest face bone. We have the palatine bone. They are also 2 in number. They form the posterior of the hard palate. We proceed to the facial bone still. We have the inferior nasal concha. They are 2 in number. There is 1 vomer and 1 mandible, all together making 14 bones. Now let's look at the hyoid bone. And this is a single bone that is U-shaped and does not articulate with any other bone in the body. It is only suspended by ligaments and muscles, and it is suspended from the styloid process of the temporal bones. This bone is located in the anterior neck between the midline and the larynx. It supports the tongue. This brings us to the vertebral column called the spine or the backbone. And this actually makes 2/5 of the total body height and is composed of vertebrae. The vertebral column forms part of the trunk of the body along with the sternum and the ribs. So we have 26 vertebral bones in an adult, while for children we have 33. As we said earlier, some of these bones fuse later in life. So in children, there are more before the fusion, while we have 26 in adults. That is because of some of them fuse later in life. Let's look at how I've come up with the 26 vertebrae. We have 7 in the cervical region or the neck region, from the atlas, which is this first cervical vertebra, up to the 7th. Then we come to the thoracic vertebrae. They are 12 in number. The lumbar vertebrae at the lower back, they are 5 in number. Then at the sacrum, we have 1, which actually consists of 5 fused sacral bones. And at the coccyx, we also have 1 that consists of 5 fused coccygeal vertebrae. Note that among the 26 vertebrae, the cervical, the thoracic, and lumbar vertebrae are movable, but the sacrum and coccyx are not movable at all. Let's look at the spine or the vertebral column as a whole. The spine has 4 bends, which are called the normal curves. Though looking at the spine anteriorly or posteriorly, the spine appears to be straight without any curve. However, out of these 4 curves, 2 of them curve in one direction and the other 2 curve in another direction. The cervical and the lumbar curves actually bulge outwards, while the thoracic and the sacral curves bulge or they cup inwards. These curves in the vertebral column increase its strength. Another thing is also they maintain balance, they absorb shock, they prevent fractures. And for a fetus, it has a single anterior concave curve. Let's look at the thorax. This refers to the entire chest. The sternum or the breastbone is flat and located in the center of the anterior thoracic wall. It measures 15 centimeters. The sternum has 3 parts. We have the superior part, the middle part, and the inferior part. The superior part of the sternum is called the manubrium. The middle part is called the body of the sternum, and the inferior part of the sternum, we call it the xiphoid process. All these three bones, their fusion occurs at the age of 25 years. Therefore, this makes sternum a good bone for detecting age of a person around 25 or someone who claims to be below the age of 25. If you look at their sternum and you find it has fused, you can just know that the person is not below 25 years of age. Let's look at the ribs. There are 12 pairs of ribs that are numbered from up to down, or superior to inferior. They tend to increase from the first to the seventh in height or length, and then decrease up to the 12th rib. Therefore, all these 12 ribs are not in the same line. They are not of the same size. They vary in size according to this order. This brings us to the appendicular skeleton. As we said earlier on, it consists of the pectoral or shoulder girdles, pelvic girdles, the extremities, both upper and lower. So starting from the shoulder girdle, there are two in number, one on the left and the other on the right. Each one of them consists of a clavicle and a scapula. The clavicle is the anterior bone and articulates with the sternum at the sternoclavicular joint. The scapula articulates with the clavicle at the acromioclavicular joint and with the humerus at the glenohumeral joint. On looking at the clavicle is an S-shaped and slender bone. It lies horizontally across the anterior part of the thorax and superior to the first rib. Its medial part is convex anteriorly, and then the lateral part is concave anteriorly. It is rougher and more curved in males. Let's look at the clavicle. The medial end is called the sternal end. It is round and it articulates with the manubrium of the sternum to form the sternoclavicular joint. Then the broad, flat and lateral end, called the acromial end, articulates with the acromion of the scapula, forming acromioclavicular joint. Then the scapula. Another name for the scapula is the shoulder blade. Next, let's look at the bones of the upper limbs. Each upper limb has 30 bones in 3 different locations. That is to say, the humerus, ulnar radius, and the hand. The humerus of the arm has 1 bone. Radius and ulnar, there are 2 bones. These are the bones of the forearm. At the wrist, we have the carpal bones, or the carpals. They are 8 in number. Then there are 5 metacarpals. These are called the bones of the palm or metacarpus. And lastly, the 14 phalanges, or the digit bones. If you add 14 to 5, that is 19, plus 27, plus these 3, makes 30 bones. The pelvic girdle. This one has ilium, the ischium, and pubis that fuse together to form one bone. Let's briefly look at the lower extremity. This also has 30 bones in 4 different locations. The femur or the thigh bone, the patella or the kneecap, tibia and fibula, altogether these are 4 bones, the 7 tarsals, the 5 metatarsals, and the 14 phalanges. In our next video, we shall look at the bones of the cervical vertebrae, in particular how many they are, their shapes, their names, what they have, what they supply, and everything else we can learn together about them. Thank you so much for watching.